So today we're going to start with our newborn assessment. First, you would start with Kawipe, which is check your orders, check for allergies, assemble your supplies, wash your hands, introduce yourself, identify your patient, provide for privacy, explain, educate, and evaluate. Once you've done that, then you will start to obtain your vital signs. Your apical pulse should be anywhere between 110 and 160. Your respiration should be 30 to 60. Be sure to listen to both of those for a full minute. When you do that, make sure that you listen with the bell of your stethoscope, not your actual this piece. All right, so then you listen for a whole minute, and then you would go ahead and get their temperature, which you would do that auxiliary. And then once you've done that, then the typical range on it is 97.6 to 98.6. And then you're going to want to go ahead and do your measurements of the baby. Now with the baby, today we have a teddy bear. And for all intents and purposes, I have a gait belt, which is used, is what I'm going to use today. I know you obviously wouldn't use a gait belt to do the measurements. But first you're going to measure their head. And when doing that, you would go close to their eyebrows, just right above their eyebrows. Here, let's see. All right. And you would just kind of go around. You would make sure it's not too tight fitting, because you're not wanting to try to injure the child, of course. All right. And then after that, so then we're going to go and we're going to move to the actual, let me turn you around here. All right. So then we're going to go and measure the actual chest. Okay. And then for the chest, you're going to do that right at the nipple line. You're just going to kind of wrap it around here. Alright, and you just go all the way around. Alright, making sure to get rid of any excess if needed. Okay. There we go. So you can actually see it here. All right, now for the abdomen, you would go down to the umbilicus, which is the belly button. All right, and then you would just measure. Okay. Measure here. Okay, and then from that, you would want to make sure that there was within normal range. You'd also want to check for symmetry of the chest. Especially you want to do that while they're exhaling, to go ahead and make sure that there's no abnormalities there. All right, so while you're doing that, you could also actually go ahead and listen to their lungs. So we'll go ahead and get this out here. All right, and we're just going to turn him around here. Okay. You want to listen to the lungs. All right. I'm going to listen here in the front. Okay. And here as well. Now while you're doing this, of course, you would want to make sure and support the baby's head, obviously, throughout the newborn assessment. It's just a little hard with this big bear. Okay, so, and then you're going to go and you're going to, you can go ahead, we've listened to the lung sounds, we've listened to the heart, made sure that there was no abnormalities there. So then you can go ahead and inspect their skin. And with doing that, you would want to make sure and look at their fingers, look at their toes, make sure that, that they are actually able to move freely. There's no discoloration. There's no extra extremities. Nothing out of no abnormalities noted. For that, you'd also want to make sure and kind of check their elbows. Make sure that they bend. Go ahead and check your reflexes with your knees. Make sure that they bend. So you go ahead and check them. Check your feet. Make sure you have the flexion and extension in your feet. Make sure that once you've done that, then you can go ahead. You can assess for Parla. We would do that just like we did with anybody else. You would check here, and then babies. Babies is actually, they have really poor vision, especially once they're born. But you just want to make sure that there's no abnormalities there, that they're not winded up. They don't have no like cross-eyed going on. No, also can note for any drainage or anything out of the abnormalities going on there as well. Make sure that they have no hemorrhages. Sometimes they could get little hemorrhages in their eyes. Be sure and pay close attention when doing that. Now, once you've done that, then you can go ahead and check your reflexes. You have the grasping reflex, which that's just where you would put your finger kind of in their hand, let them hold on to it, make sure that they can do it. The rooting is where you would run your finger across their cheek. That's to make sure that they're able to actually have that sucking reflex once, because they're going to want to eat, obviously. So you want to make sure that they're able to do so. And then you're going to want to make sure that you palpate back here at your fontanelle and your suture lines. Make sure that it's not bigger than it's supposed to be. Make sure that there's nothing going on there. Once you did that, you would definitely want to make sure that their soft spot's not too big. And then typically that goes away within a few months. Let's see here. So then after that, you would want to go ahead. We could do, we did all of our reflexes. So then we would go and make sure that they have an actual sucking reflex. And that you could do with the bulb. You could do that just to make sure that they have what they need when they get ready to eat. That's very important. Then you would want to go ahead and make sure you could inspect their chest. Make sure that there's no abnormalities there with the when you're breathing. Make sure and check that the symmetry is even. And then once you've done that, you can go ahead, listen to their bowel sounds. So we're going to go ahead and do that. All right. So we're going to just kind of listen here. Okay. And of course you would want to make sure that you listen in all 4 quadrants. Okay. Make sure that they do have active bowel sounds. The first bowel sound, or the first bowel movement, is typically meconium. You want to make sure and alert the parents of that so they don't get freaked out when they have that first black sticky type stool. Alright, so then you want to make sure that you do around your umbilicus. Make sure where they did the where they cut the umbilical cord, go ahead and assess it. Make sure that there's no abnormalities, no anything going on there. Note the color, if there's any drainage. You'd want to go ahead and note the, if it had odor, make sure to note that. And then go from there. Alright, so then you would want to, you go ahead, you could palpate the abdomen while you're, make sure that you don't feel any masses or anything out of the normal. Then you would want to go ahead and inspect their back. With doing that, you'd want to make sure that there's no curvature. Curvature is not something that we definitely want. And then you would want to, of course, inspect their genital area. While doing that, you would want to note if there's any type of drainage or anything going on. Make sure that they don't have like a rash or anything going on their bottom. If they're wet or if they voided, then you would go ahead, change them. You would note the color of the urine. Go ahead and note if it has an odor or anything like that, along with the bowel movement. All right. So then, then you would do, just make sure, like I said, that the babies, make sure that they have actual movement throughout their joints and their bones to actually do what is needed. Then you would just make sure that they have their ID band. You would want one on their, one up here, and then you would want one on their foot as well. The reason you want two of them is to make sure that they have it on there. Obviously, they are babies, so they are newborns, so they'll constantly be trying to move. And then you would just document all your findings and procedures.